With that, I'm going to turn it over to the experts and I'm going to let them get started. So Dr. Mary Braithwaite will kick us off.
Good evening and welcome everyone. Thank you so much for joining us today. I'm excited to be here with you all. And I bring you greetings on behalf of Durham Public Schools, Department of Health and Human Services, Durham County Department of Public Health, War for Life, and Chapel Hill Pediatrics. We are the co-sponsors for this town hall. Thank you very much for coming. I'd like to introduce our speakers and then turn it over to Dr. Wong. So Dr. Wong, Charlene Wong, is the Chief Health Policy Guru for COVID-19 for Department of Health and Human Services. Dr. Ibukun Kalu is an infectious disease doctor in pediatrics at Duke. She's our infectious disease specialist. Dr. Mary Cooley is a pediatrician at Chapel Hill Pediatrics. And I am Dr. Mary Braithwaite, also a pediatrician at Chapel Hill Pediatrics. We have other experts on the line as well. We have Ms. Trish Howard, who's DPS lead nurse, and Delois Prince, who is the DPS COVID response manager. Thank you so much, and I would like to turn it over to Dr. Wong now.
Thank you so much, Dr. Braithwaite. I'm going to go ahead and share my screen. All right. Mary, are you now seeing my screen in presenter mode? Wonderful. All right. Well, thank you so much for the opportunity to be here. Again, I'm Charlene Wong, Chief Health Policy Officer for COVID-19 at the Department of Health and Human Services. I am also a practicing primary care pediatrician at Duke, and we are just so thrilled to be here today to talk about something that we've been waiting for. I myself have children in this age group, 5 to 11, and so really excited to be talking about COVID-19 vaccines for children. And what I'm going to share with you today is that our kids have a spot to take their shot against COVID-19. I think as we have all been made too well aware of over the last many months, including during the Delta surge, children and our younger children can get the COVID-19 virus just like everyone else. And some infected children get really sick. And I know Dr. Kalu could talk about that in the care that she's provided to our kids in the ICUs. And we know that our kids can also experience long-term side effects, things that are really bothersome to kids, like feeling really tired, sort of having this brain fog. During the most recent surge, that Delta surge, our pediatric or child cases of COVID-19 rose substantially in the US, 240% in the US, really increasing the urgency of finding ways to protect our children. And now we have that, a safe and effective vaccine, or we're about to have that, I should say that, we're about to have that. Getting school-age kids vaccinated will help them get back safely to being with family, friends, keeping our kids in school, which we know is so important. And importantly, the vaccine for kids, as it was for our teens, as it was for adults, is free, safe, and effective. So let's start with a couple of terms just to make sure everyone understands, because there are a lot of abbreviations, CDC, FDA, EUA. So just wanted to make sure we just make sure that everyone knows what these terms mean. So the CDC is the Centers for Disease Control. They provide health information and guidance that protects our nation against dangerous health threats. The FDA is the Food and Drug Administration, and they're responsible for protecting the health of Americans by making sure our medical drugs, products, and food supply are safe. During the COVID-19 pandemic, many more people learned about this term EUA, or Emergency Use Authorization. And in a public health emergency, manufacturing and the approval of vaccines and other treatments can be streamlined by using this Emergency Use Authorization. And EUA does not affect vaccine safety because it doesn't impact the development, like the research or the clinical studies that go into making the vaccines and testing them and studying the side effects and adverse reactions. Instead, it speeds up the manufacturing and a bunch of the administrative processes. So excitingly, last Friday, the FDA chose to authorize, with an emergency use authorization, the Pfizer-BioNTech COVID-19 vaccine for the prevention of COVID-19, including kids ages 5 to 11. That authorization was based on the FDA's thorough and transparent evaluation of the data, and I'm going to tell you a little bit about some of those data today. and included input from an independent advisory board of experts who overwhelmingly voted in favor of making the vaccine available to children in this age group. And that's because they determined that this Pfizer vaccine met the criteria for this EUA, or emergency use authorization. And then, very hot off the presses, as in like a few hours ago, the CDC, which again makes those recommendations and provides health information and guidance, they just made the recommendation in their special committee that meets again with independent folks on that committee, and recommended also the use of this vaccine, COVID-19 vaccine, for children ages 5 to 11. The next step is that we are waiting for the CDC director to adopt that recommendation, and then vaccines are going to be available very soon for this age group. So of course, we get a lot of questions from parents saying, well, what's the evidence? How are these vaccines studied? So these vaccines in children ages 5 to 11, like in our teens, like in our adults, were tested using clinical trials. And the results from the clinical trials for children ages 5 to 11 showed that the vaccine was safe and effective. The trials in this age group started in March 2021 and showed that there were no serious safety concerns or serious side effects noted in these clinical trials and still ongoing studies. Parents also want to know, well, what did they see in regards to side effects or adverse reactions? They saw that these sorts of temporary side effects for the COVID-19 vaccine for kids 5 to 11 were very similar to what they saw in our teens and young adults and in adults, which is to say that, these are these temporary reactions that go away. And in the study that included 4,500 children from more than 90 clinical trial sites from around the world, again, looking in totality at these children who were in these different clinical trials, the vaccine was shown to be 90.7% effective in preventing COVID-19 in children ages 5 through 11. Again, more than 3,000 kids participated in these trials. And this is a really comparable number to the number of children included in similar trials for children. So, for example, for our chickenpox vaccine, it was about the same number of kids in their earlier clinical trials as well, for kids like ages 1 to 11, for example. We also want to think about, well, who were these children who were in these trials? And the trials included volunteers from different races and ethnicities. And you can see on the slide here, we actually included the breakdown. So 77% white, 6% African American, 8% Asian, 17% Hispanic Latinx, 7% multiracial, and less than 1% other race. In these trials, the children were given 2 doses of the vaccine, just like we saw for the teens and for the adults. And the difference being that each of the doses in the clinical trial was a smaller dose, a third of the amount of the dose given to people 12 and older. And the doses were given the same number of days apart, 21 days apart. How these vaccines work to protect your child, it is the same as the way that it works to protect your teens and adults. So vaccines act like COVID, but without giving your child the actual virus, meaning that your child cannot contract COVID-19 from getting vaccinated. After your child gets the vaccine gives their body a set of instructions to make what's called a protein that safely teaches their body how to make the germ-fighting antibodies, which are those antibodies that we want, so that if they ever get exposed to the real COVID-19 virus, they'll already have those antibodies ready to go. Their body then destroys the instructions and that protein from the vaccine, but the antibodies that your child's body has made stays there, as they do with the other types of vaccines that we give children, so that it can fight off the real virus if it tries to attack them. Let's talk a little bit more about the temporary side effects. Again, these temporary side effects that we saw in the trials for kids 5 to 11 were pretty similar, both in the types of side effects we saw, how often we saw them, when you compare them to the trials for younger people ages 16 to 25. So you might expect that your child might experience a temporary sore arm, perhaps having a headache, maybe being tired or achy for a day or two. And these temporary reactions are actually a really good sign. It's a sign that shows that the vaccine is working and should go away within a few days. When I got my vaccines, when I got my booster, I definitely had a sore arm. After 1 or 2 of the doses, the way my husband put it was maybe I wasn't as nice as I usually was. But to me, these were good signs because I knew it was a sign to me that my body was doing the work that I wanted it to do to give me that protection. We know based on these clinical trials that the COVID-19 vaccines protect your child from serious illness, and the risks of serious side effects from the vaccines are far, far, far less than the risk of serious illness from COVID-19. And when I talked about that very thorough and transparent process that the FDA and the CDC go through, they are really weighing that. What is the benefit? What are the risks? And, based on the FDA and the CDC's assessment of the data, again, the risks of the serious side effects from the vaccine are far less than the risks of serious illness. So really, when you think about that risk-benefit ratio, that is why the recommendations are coming out for this vaccine in this age group. An extremely rare side effect of the vaccine has been seen in some studies, but not with younger children so far. And that's that serious side effect that you may have read about is myocarditis, or a type of heart muscle inflammation. This myocarditis inflammation has been seen in some older adolescents.
Miocarditis es una infección que se puede.
This type of myocarditis has been seen in some older adolescent and young adult males, mostly with mild cases. And in these young people, they typically recover on their own or need no to minimal treatment. There were no cases of myocarditis seen in children ages 5 to 11 in the clinical trials. And as it has been the case with all of our vaccine trials for adults, for teenagers, these are some of the most studied vaccines under the tightest scrutiny looking at safety ever conducted in the United States or in the world for that matter. And so there will also be ongoing safety surveillance to continue to determine, particularly, for example, if this myocarditis, this rare occurrence, is a risk to younger children. So getting vaccinated. So far, only the Pfizer-BioNTech vaccine has been authorized, and now just right a few hours ago has been recommended by the CDC's Committee on Immunization Practices for kids to 5 to 11 years old. Again, I'll reemphasize it is a smaller dose than the adult vaccine. And because it's a smaller dose and the way that it's getting shipped and where you need to get it, it means that not every location, meaning a primary care doctor's office, a pharmacy, a health system that has the Pfizer vaccine, it doesn't mean that every one of those locations will have the younger child, 5 to 11-year-old Pfizer vaccine. The great news is that we have already more than 650 locations in North Carolina that we know are going to carry the Pfizer 5 to 11-year-old vaccine. So don't worry, we have plenty of vaccine that is going to be available across the entire state of North Carolina, and certainly in Durham and in this area, in the Triangle area. Kids can be vaccinated at any location that has the smaller dose of the Pfizer vaccine available. And we already know where the first wave of these vaccines are going. This is going to be in pediatricians and other children's healthcare providers, doctors' offices, hospitals, local pharmacies. And unlike some vaccines, we know that the COVID-19 vaccines will be free everywhere. It does not matter if you have insurance, if your child has insurance or not, it will be free, no out-of-pocket cost for children, adolescents, or adults getting the COVID-19 vaccine. Importantly, parental consent is required for the COVID-19 vaccine for children. We've already gotten a lot of questions, and I think some questions came in today about where can my child get the vaccine? The shoulder is the recommended muscle for the vaccination for kids 5 to 11, but the thigh can also be used. And again, the kids 5 to 11 will get those two doses, smaller doses, but 2 doses 21 days apart, just like for older kids and adults. The COVID-19 vaccines can also be given at the same time as other vaccines. Of course, we're now in the time of flu and flu vaccines, and so kids can get both of those vaccines together, as can teens and adults. I just wanted to put in a plug for vaccines for adolescents because we still have a lot of adolescents in the state and in the area who have not yet been vaccinated. So just a reminder that any teenager 12 and up can get vaccinated now with the Pfizer vaccine. The Pfizer vaccine is actually fully approved. So it's a step, that step after the emergency use authorization for our 16 and 17-year-olds and anyone older as an adult under a different name. And the Pfizer vaccine is still available under emergency use authorization for our teens 12 to 15 years old. I want to make the point, and I know we have some questions coming up, that the dose for these adolescent vaccines is the same as the adult dose, and again, also includes 2 doses 21 days apart. More than half of 12 to 17-year-olds in the US have gotten at least 1 dose of the COVID-19 vaccine. I was just looking at our own COVID-19 dashboard here in North Carolina. We're not quite to 50% in North Carolina. So also, again, wanted to reemphasize, when you go bring your younger child, if you have a teen who still hasn't been vaccinated, I know that all of our practices, any of our vaccine providers would be very happy to vaccinate families. We have seen some and heard some very lovely stories of actually whole families going together, including with parents who perhaps haven't had the chance to get vaccinated yet. We actually have a website that is specifically for teen COVID-19 vaccine information, and that's teenvaxvax.com. The way that kids can find their spot to take their shot against COVID-19 is actually the same as the way that we have really encouraged others to find their way to a vaccine. We have 2 main options. The first is we have a COVID-19 vaccine help center. You can see the number listed here. It operates 7 days a week. There are both English and Spanish speaking agents available to help you find a spot and answer questions that you might have about the COVID-19 vaccine. We also have on our website, myspot.nc.gov, where you can put in your zip code and find vaccine providers near you. And we're working to make sure that as the vaccines for younger children become available, that folks will be able to know which of those vaccine providers have that smaller dose available. Because again, remember, it is a different dose. And if you're interested in getting more information, we launched a few weeks ago a new webpage on our website dedicated to providing vaccine updates and information for kids 5 to 11. If you go to our website, it also provides a spot here where you can put your email address if you want to get regular updates around vaccine events and new guidance around the 5 to 11-year-old vaccine authorization and recommendations. We plan to be updating it maybe even sooner than November 4th, based on what's happened today with the CDC. And with that, thank you so much for your time. I will stop sharing and turn it back over to Mary.
Thank you, Dr. Wong. Many of the things you stated directly address some of the questions that we've already received. I would like to go through those, and then we'll also cover some of the questions that have come up in the chat. The questions in the chat will be directed to me. I know there are several of them, and some of us have some very strong feelings about the vaccines. I want to let you know this is an opportunity for education only. There's no mandate here about vaccines in children. This is only for education. So the first question I'll direct back to Dr. Wong. Do parents need to worry about kids getting COVID? Don't kids pretty much do pretty well with COVID and not get really sick?
Well, fortunately, in comparison to our older adults, kids in general have not gotten as sick. That being said, we have had so many children who have contracted COVID, many of whom have become very ill because of COVID. And I'll let Dr. Kalu also speak to that, working in Duke Hospital and taking care of kids who get really sick. And the thing that's hard to know is to predict, which of those kids is going to get really sick, right? And I think on top of just getting, really severely ill, which again, fortunately, we're glad, right, that kids have not been in that category, because certainly we know with some of our other viruses like flu, we really do worry about that. We also know that the vaccine is a really safe and effective way to protect not just them, but also those around them. We know that there are still going to be younger children who are unable to get vaccinated. We know that there are people around them who might be immunocompromised who have gotten vaccinated, but we know the vaccine is just not going to work as well for them. And while we are glad that our COVID-19 vaccine or COVID-19 cases are coming down, we still have a lot of COVID-19 in our communities. We are still, I've seen Dr. Cooley shaking her head. I mean, we're getting positive cases in our clinics still. And again, we really want to vaccinate as many people as possible because we really want to put this pandemic behind us. I'm sure Dr. Cooley or Dr. Collar could comment on that as well.
Yes, happy to. Thank you for that summary. I agree completely. We are still seeing cases, and while we know that kids are more likely to have mild infections, unfortunately, it's hard to predict which child will often end up in the hospital requiring ICU care. And even if it's not from the initial infection, we are seeing cases in our hospitals and ICU from the post-COVID syndrome, multi-system inflammatory syndrome in children, which we'll refer to as MISC as we go along.
Thank you.
And actually, Mary, can I add one other thing? I'll just
Absolutely.
add, there's also the these children, these teens, younger children that we are seeing with this long COVID syndrome, which there's still, we just don't know that much about it still yet, to be honest with you. But these symptoms that these kids are experiencing are really impacting their ability to go through their day-to-day activities. And again, I don't want to discount. It is true. Kids are not getting as sick from COVID-19 as our older adults or adults with comorbidities. But like I think we've all said, it's really hard to predict which kid, and you certainly don't want it to be your child, who gets really ill or has these really long, persistent, bothersome symptoms.
And there are several questions about myocarditis coming up. And I think there is myocarditis that can occur with the vaccine as well as with the actual infection itself. Dr. Kahlo, could you speak to that? The difference and the severity? I'm seeing a lot of questions about that.
Absolutely, it's a valid question. So just taking a step back, myocarditis, which is inflammation of the heart, can occur for a number of reasons. Most commonly, when we see it in children, it tends to be around a viral infection. And there are a number of viral infections that children get. Most of the time, we actually don't know they have a viral infection because they handle it pretty well. But when we see myocarditis, that inflammation around the heart, there's some key viruses we look for. And when we track this out across all age groups, it just seems to occur more commonly in our teenagers, and again, more commonly in males. So now switching gears from just what we've typically seen in the past, when we provided vaccines at the population level. So when you're vaccinating millions of people, there may be rare side effects that you pick up that you may not pick up in a trial. And this is pretty common. This is what we find out with a lot of other things that are out there, including something as simple as Tylenol. This is how we find out details when we use it at a population level. They did pick up on a signal and picked it up really early that young adult males, particularly those between about 15 to 30, although the range now covers 12 to 30, have myocarditis occurring at a rate that's higher than what we would typically expect from all the viruses. However, COVID-related myocarditis is much worse and occurs much more frequently as compared to post-vaccine related myocarditis. That's still a conversation you should have with your provider. It is a true concern, but it's so rare that risk can easily, so when you compare head to head, the benefits of getting your vaccine outweighs the potential risk of myocarditis, especially in our young adult males. They often, if they end up in the hospital, they often end up in the hospital for a short period. They don't require a lot of care in the post-vaccine group, and they leave the hospital and seem to do well, and at most have returned back to normal. In the COVID-related myocarditis group, unfortunately, that does impact the heart and leads to long-term outcomes that require specialist follow-up. And so head-to-head, vaccines still protect against long-term worse outcomes in regards to the heart.
That's very helpful. There's another question that came up about the risk of severe COVID. Is it greater in children who have other comorbidities or other severe or chronic conditions? Or could any child who's very healthy even potentially get very sick from COVID? Dr. Cooley, do you want to address that?
Sure, yeah. Well, I know that about 30% of the kids who have in this age group, in this 5 to 11-year-old age group who are hospitalized with COVID, about 30% of them have no underlying conditions whatsoever. So that tells us that COVID is really random. We don't know who is going to get very sick from it. And that's true in adults and it's true in children. And of course, children who have a lot of medical complexity are higher risk of bad outcomes, including hospitalization and ICU admission and even death from COVID. We know that healthy kids have also can have bad outcomes.
Thank you. One mom said, well, one parent, I should say, said, my children already had COVID. Would you still suggest they get vaccinated? Dr. Wong?
Yeah, we do. And first of all, I just want to acknowledge there is immunity that you get from getting infected with COVID-19. Actually, there was a report that just came out, I think it was on Friday, actually, that really looked at what's the immunity or protection that you get from having a natural infection versus the immunity or protection that you get from a vaccine. And I think the simplest way to think about it is, again, acknowledging there is some protection. And for some people, really good, really long protection from a natural infection. What you can see when you compare getting naturally infected or having COVID-19 and then getting vaccinated is you can feel much more confident when you get vaccinated that you're going to have really strong and longer protection. What we've seen in people who have gotten infected with COVID-19 is that some people have that same thing, really strong, really long. We have also seen a lot of people who have gotten COVID-19 for whom that protection actually goes away quite quickly. And it's like Dr. Cooley, Dr. Kalu was saying right now, it is impossible for us to predict right now, like which of those groups you might be in. So again, there's a lot more confidence in knowing that you have that longer and stronger protection with COVID-19. That being said, because we actually feel quite confident that in the short term, you likely have reasonably good protection, especially at the beginning when we didn't have as much COVID-19 vaccine. We said, if you wanted to wait a few months, 2-3 months after you had your COVID-19 infection, you could feel pretty good that you probably had really good protection, at least for that amount of time. Certainly, we want people to be protected longer than that. And we are getting more and more data with each day that passes that the vaccine protection is really long. I see some of the comments in the chat. Again, we want to be very transparent here. This is the goal here is that we want to make sure parents, caregivers, family members have good information. We don't have as much data on the long-term outcomes of the children 5 to 11. These trials, they did start in March of this year. We will get more and more data with every passing day. But I will say, that when we're looking at the teens, when we're looking at the young adults, all the evidence that's coming out is really positive, really positive, reassuring that we're getting that long protection and not seeing, far off side effects that pop up, many months later. And because of that, you can feel even more confident as a parent, as I do, because I have kids in this age range. It gives me more confidence that, that I don't see why it would be different for the 5 to 11-year-olds.
So we have 6 months of data, and thus far the children have done well post-vaccine. One parent is asking if their child should get a booster after 6 months. Do we know that yet?
There's no recommendation for a booster for this age group yet.
Okay. And another parent
but I will put a plug. I will put a plug if you have been fully vaccinated with a Pfizer or a Moderna and you're an adult or Johnson & Johnson, please check. It's on our website. You can check to see if you're eligible for a booster. And we do encourage folks to get a booster shot. We have a lot of supply, easy, free to get a booster vaccine.
And for a child who's had COVID, should they still get 2 shots or just 1?
I can help with that. So 2 vaccines are still recommended, even if you've had a prior infection. Note that if we measure you over time, you might be boosting yourself, and that's completely fine. Some people with prior infections have chosen to wait the 90 days from their infection, and that's likely fine. But what's really recommended is for you to isolate for your 10 days if you're infected, as we would recommend for everyone. And after your 10-day isolation, it's safe to get your vaccine.
Thank you. Now, this question has come up several times in the chat, and also we received it via email. Parents are asking about the menstrual irregularity that they're seeing in some girls post-vaccination and women. Dr. Wong or Dr. Kalu, can you speak to that?
I'll start, and then Dr. Cooley, Dr. Kalu, please feel free to jump in. I actually specialize in adolescent medicine, so I think a lot about period irregularities, problems, not enough periods, too heavy periods. So I think one of the things just to make sure folks are aware of is that there are a lot of things that can change a young woman's or an older woman's periods. If you're really stressed, if you have a cold, all of these things can cause our periods to do different things, sometimes heavier, sometimes lighter, really hard to predict. We have seen that sometimes individuals who have been vaccinated, they do notice some changes in their periods. like when we see these period changes after you've had a cold, or, you've recently lost weight, or you've been under a lot of stress, or teens have been under stress because they're going through exams, or young adults in college will see this. Sometimes they're going through exams in school and they're really stressed out. We see that their periods just go back to the way that they were before, sometimes regular, sometimes irregular, because our teens often have irregular periods. And again, there's been a lot of interest in looking at, is there an impact on fertility from these vaccines? And again, that's been even better studied over time. And there's no evidence to suggest that the vaccine is going to impact a young woman or a young man's ability to get pregnant as a woman, or to get someone pregnant as a young man in the future.
Thank you. This series of questions is for a general pediatrician. Dr. Cooley, can I get the shot in my leg instead of my arm?
Yes, you can. That is certainly an option at our practice. Depending on where you go, for example, if you went to a pharmacy or something like that, they might not be comfortable with doing legs, but definitely pediatric providers give vaccines in legs all the time. I do actually have a suggestion for kids who would prefer to get the vaccine in their legs. And especially this is true if you're going to go somewhere where you will get your vaccine in the car. And that's to wear shorts or some other article of clothing where it's easy to get to your leg, because the last thing you want to do is take your pants off in the middle of a parking lot. So I do recommend wearing shorts, and that actually goes for shirts as well. It's easier to get your vaccine if you can just pull your sleeve up and get your vaccine that way.
Thank you. Can the vaccine for COVID be given on the same day that I get my flu shot or another vaccine?
Yes, it can. Absolutely. That is not a problem at all. It is possible that you might have a bit more of the usual side effects, things like fever and fatigue, but we don't have any evidence that it's going to affect the effectiveness of the vaccine or increase your risk for severe side effects.
Thank you. Now, there are several questions that have come up about this 11 to 12-year-old cutoff. Some parents are asking, if their child is turning 12 soon, is it better to wait until they turn 12 to get the higher dose of the vaccine, or should they go ahead and get it at the third of the dose that's recommended for adults and then get the higher dose later? Some are asking if they have a small 12-year-old, should they get the smaller dose for that child? So this 11 to 12 is a bit of a question for many parents.
Yes, I've gotten that question from lots of parents in my clinic. And my recommendation is to go ahead and get the vaccine as soon as it is available for your age group. So if you have a child who's 11 today, she's going to turn 12 in November or December, go ahead and get that vaccine, because it could be next week that she has another child in her classroom that exposes her to COVID. Of course, she won't be quite fully vaccinated by that point, but she would have some protection. Given the prevalence of COVID in our community right now, I would not recommend waiting. I believe if a child turns 12 between the first dose and the second dose, they would get the larger dose at the second dose. That would be fine. But I think that the 5 to 11-year-olds responded really nicely to this vaccine. And I don't think there's any reason to give an 11-year-old a bigger dose. I don't think that's necessary. It's important. My immunologist colleagues have told me that it is not the size of the child that's important. And some people will often say, well, my 11-year-old, she's 5'4" and she got her period 2 years ago. Why shouldn't she get the older kid version of the vaccine? But her immune system is still only 11 years old. So your immune system is not necessarily related to your age, it is related to your age and not necessarily related to your size. So, yep, get what you can get when it's offered to you.
Perfect. So is it okay, Dr. Wong, to wait longer than the 3-week interval where we have Thanksgiving coming up? Some people will be leaving. They want to get their vaccine as soon as they can, and then they'll be gone for a while. Is it okay to wait longer than that 3-week interval and then the alternate question is, should they get their second dose a little early if they have to leave?
So there's a little bit of a window. It doesn't have to be exactly on 21 days. There's a little window before and after. If folks need to wait, I think that is totally fine. And certainly we know as we're getting our kids their usual vaccines, sometimes you don't hit it right on the nail. And then same thing as we've seen our adults and our teenagers get vaccinated, certainly people weren't necessarily getting it exactly 21 days. I will say, because it is great to hear there are a lot of people who are very anxious and excited to get their 5 to 11-year-olds vaccinated. Just know we have a lot of vaccine in the state. And so be patient if you're, looking around trying to get that appointment. We actually have a lot of vaccine. It's very different than when we started with the vaccines for adults back in December. We're just a totally different scenario. So just know that there will be a shot for your child if you want to get them vaccinated. And I know I'm hearing a lot of parents who are saying, I really just want them to get them as quickly as possible so they can be as protected before all the different holidays that are coming up. But just know, again, that people should be reassured that we have a lot of vaccine that's going to be in the state for these kids.
And we do have a quick update. The CDC does say that if a child is turning 12 between doses, they should get the 10 microgram dose. So that's very new that we just became aware of. Thank you, Dr. Kalu. So another question for Dr. Cooley. Is it okay to give my child Tylenol before the vaccine? Is it okay to give it after the vaccine? And if so, when?
So my recommendation for this would be the same as my recommendation for Tylenol for most vaccines. I don't usually recommend giving Tylenol before the vaccine because you just don't know how your child is going to do, and they may be just fine. They may be content to just lay on the couch and maybe have a few extra snuggles or read an extra story, or they might be a little sore, but it's nothing that maybe a walk around the block or a little massage or a bath couldn't fix. Also, if you're going to have soreness post-vaccine, it's usually a few hours later, by which point your Tylenol has probably worn off. So I usually suggest to parents to hold on the Tylenol and feel free to give it later if it seems that their child needs it.
Perfect. There was a question in the chat directed to me about each panelist declaring conflicts of interest. I'd like to state that I have none. Dr. Cooley?
I have none.
Dr. Wong?
Same, none.
Dr. Kalu?
A conflict of interest. I do have research funding from National Institute of Health, but nothing related to vaccines.
Okay.
Yeah, and I have research funding from Center for Medicare and Medicaid Services, but definitely not related to vaccines.
Okay. We have funding from insurance companies. And yes, we have some grant support for the efforts that we do in the community, but we do not have any payment from any private companies aside from insurances. Next question. These are about studies. There's a question as to whether the risk of illness from COVID is lower than the risk of issues or complications from the vaccine. Dr. Kalu, some people are asking if their child is really, really healthy, do the benefits of receiving a COVID vaccine when they may not get sick outweigh the potential harm of potential myocarditis or post-vaccination side effects?
Absolutely. So the risk that we know from COVID infection includes what we've mentioned. So post-COVID syndromes, long COVID, or even just having an infection that's severe enough that puts you in the hospital. When we look at and you can calculate this is just math, and we can kind of walk through those numbers. When we look at the risk of any vaccine-related adverse effect, it's so low that the benefits of getting vaccinated continue to outweigh the risk of getting a COVID infection. I know we've approached kids, and I see kids every day. We work with kids. We do a lot of work to protect kids. So it's a tough argument when I sit in settings where people say, well, why should we bother about kids? They're not they only get mild infections. Again, that argument is really not true. We have kids that get really bad infections, and I will be bothered by every kid that gets infected because there's something we can do to prevent that.
And let me just say, so COVID has been the 8th highest killer of kids in this age group over the past year, right? Any death that we can prevent in a child is, like, you cannot state the value of that, right? And so, and again, because we've said that it is hard to predict, there are some health conditions which we know are higher risk, but as Dr. Cooley mentioned, right, we also see, and it's not just our little kids, right? We see it's happened in our young adults, it's happened in our teens, where you've got these like really, really healthy young people who get really sick unexpectedly and have passed away. And so now that we have this COVID-19 vaccine, it's going to prevent these deaths, which are every single one, obviously a huge tragedy when we're talking about kids ages 5 to 11. It'll prevent these admissions to the ICU where Dr. Kalu is rounding on them and working with them on the ventilators, and prevent also these significant long-term adverse outcomes that we can see in kids. Again, we are glad that in general, most kids don't experience those things, but again, it is the 8th highest killer of kids in this age group over the past year. So it is not a benign infection.
There's something else that I've seen regularly in my practice, and this has not been well studied yet, so I don't have data to back it up, but I have seen lots and lots of teenagers who have an enormous amount of anxiety about COVID, who have felt dramatically better after they were vaccinated. It's like a weight came off their shoulders, and I would have a hard time believing it, except that that's exactly how I felt when I got vaccinated. And I'm hopeful. I see so many of these children 5 to 11 who have really suffered during this pandemic for lots of reasons, but many of them, it's an anxiety over COVID specifically that is driving a lot of their symptoms. And to get them vaccinated, I'm hopeful that they will start to feel better. So I don't want to discount all the medical data. I think the benefits by far and away outweigh the risks, but it's even more than that.
Thank you. There are questions that are coming up in the chat about how to get their child vaccinated, how to access vaccines. I'd like to state that Durham Public Schools is working really hard at increasing access to vaccines at schools, and you all will be hearing more about that. Several other school systems are doing the same. Also, Durham County Department of Public Health has several events upcoming, and Hill Pediatrics does as well. You will be able to find the vaccine in many different venues. Yes, you may have heard about the rollout in waves, but that was to help distribute the vaccine equitably throughout the state, not to make it difficult for people to access the vaccine, to increase the access. So call your doctor's office, call your school to see if they have anything linked up for parents to get their kids vaccinated.
And I'll also just, again, for those of you, if you can also go to myspot.nc.gov, because we have a lot of the local CVS's and Walgreens and Harris Teeters who are getting COVID-19 vaccine for kids as well. So like I said, parents who want to get their kids vaccinated, don't be stressed. There is going to be a shot for your child. We have a lot of supply in the state, and we'll only be getting more. So.
There's a question about the Pfizer vaccine as it compares to other COVID vaccines. There's a question about whether anyone should wait on Moderna or J&J, and how would you rank these vaccines together compared to each other? Dr. Kalu, would you?
Sure, I chuckled a bit at J&J. I would not wait for J&J. The timeline is non-existent at this point, so that may be an easier question to answer. For other mRNA vaccine options, so Moderna versus Pfizer. Pfizer hit the luck of the draw by starting a few things earlier, including their submission earlier. However, Moderna's actually had similar timeline in terms of clinical trials and trials all the way down to 5 to 11-year-olds. So I expect that we would have substantial data from them as well. That's not just in a press release. So data that shows the number of infections, what happened with those that got their product versus placebo, and that data will be presented through the FDA and the ACIP or CDC, as we've seen with Pfizer. So the brand really doesn't matter. We should expect Moderna options shortly, but because that timeline might be extended into the holidays and into 2022, I would encourage people to go with options that are available now, knowing that I think we're still waiting for the official CDC word, but we expect that this week with the ACIP vote, that we would have available options down to age 5. So I strongly recommend getting what's available for your child.
Do we anticipate that any vaccines will be available for younger kids this year?
Less than age 5? Is that
Yes.
where you? We anticipate vaccine options will be available. I think the trials go down to 6 months.
Okay.
And so we would have vaccine options from about 6 months, which is similar to what we've done for influenza. I don't know the timeline for that. As I mentioned, I don't work directly with any of these companies on vaccine trials. And so I can guess in 2022, but my guess is as good as anyone else on this call.
There's a question about allergy risks. Dr. Koo, if you want to answer that. If a child has a peanut allergy, can they still get the vaccine? Are there any allergies that they should be concerned about?
Yes. So most allergies are fine to get the vaccine. The one thing that is worth mentioning is that if you have an allergy to polyethylene glycol, that is commonly a medication called Miralax used for constipation. That actually is a contraindication to getting the mRNA vaccines, and you should talk to your doctor. That's a fairly uncommon allergy, but it's not impossible. Other than that, things like peanut allergies or egg allergies. I actually have alpha-gal allergy, which is a mammalian meat allergy. Basically, the recommendation is to stay for 30 minutes after you get your vaccine instead of the usual 15. So when you get your vaccine, you'll mark off that you do have an allergy, and they'll just monitor you for another 15 minutes. Allergic reactions are rare, but not impossible. And all of the vaccination sites are equipped to handle an emergency should one occur. They all have EpiPens and whatnot.
Thank you. Now, this last question, let me just say this, there are several other questions. We'll have to answer those in another fashion. We are rounding out our time here, but I did want to bring up one thing that has come up a few times, and that's when you have a potential side effects from the vaccine. Will you be able to be excused from school for that? Nurse Howard and Ms. Prince, do you want to speak to what happens after a vaccine if kids feel sick? I think Donald may have to unmute Trish. And while you're working on that, one of the other issues is, could you get a note from your doctor, Dr. Cooley, if you do have side effects that make you feel like you don't want to go to school?
Yeah, I think I expect that we will be getting a number of those calls at our practice, and I would encourage people to call their pediatrician if that happens. In general, I think if the reaction is consistent with the anticipated reactions to a vaccine, then yes, we would be happy to write a note to excuse you from school. If it's more complicated than that, so for example, you would not expect to have cough and congestion or sore throat after the vaccine. So if a child, 48 hours after the vaccine develops a new cough and a fever, that might not actually warrant a note. That would probably warrant a discussion with your child's doctor about they probably have a new cold because, it's November and we're all coming down with colds this time of year, despite the masks. So yeah, that's how I would probably handle it.
Thank you so much. So yes, I'm going to echo what Dr. Cooley said. If we, just like with the adults, we anticipated side effects, there are certain side effects that are normal side effects that we could anticipate to see within the pediatric 5 to 11 years old. However, just as Dr. Cooley stated, if the symptoms are existing beyond that time frame, or symptoms that are not typical of the vaccine, such as loss of taste or smell, we may recommend that you get a COVID test just to rule out With that said, I'm going to use this to plug DPS's testing program. If you are a parent of DPS and you have not signed your children up for our pool testing, which also makes them eligible for the diagnostic testing, please visit our website and go ahead and register your child. Because in this case, if we have a child who's symptomatic, we will be able to do a rapid test before we send that child out who may not be feeling well, post the coverage days that Dr. Cooley just spoke about.
Thank you so much. Thank you all for your participation in this panel. To the panelists, we appreciate your time. And to DPS, Durham County Department of Public Health, Chapel Hill Pediatrics, War for Life, Department of Health and Human Services, we're grateful for your support in helping to disseminate accurate information about this evolving pandemic and its effect on children. Please know that we will have a Spanish version of this town hall on November 8th at 7 p.m. And I would like to acknowledge a few of our special guests who are here. And the Durham School Board Vice Chair, Ms. Lewis, is here along with Mr. Jenkins. I believe he's here, our health director of the Department of Durham County Department of Health. I'd like to see if you guys want to send greetings, and then we'll have you guys close it out if you don't mind.
I do apologize for being late, a little tardy to the party. However, I'm a budding Doctor of Public Health student, so I had class today. But this is a wonderful event. Special thank you to Dr. Charlene Wong and all of our panelists for thinking it not robbery. And my great friend, Dr. Ibukin Kailu, have to make sure I say her married name right, and who has been my partner as far as all the COVID-19 updates we've been given to our elected officials and everything. To Ms. Prince and Nurse Howard and everybody from DPS. This just speaks to what the true power of public health is. It's all about collaboration, and it's all about protecting our most vulnerable population right now. That's our big. So we are on the cusp of really doing something that we've been waiting to do for quite some time. So again, we thank you so much for your support, and we look forward to successful events and more information to come really, really soon from us. So I'll pass it on to Madam Vice Chair.
Thank you. And is Ms. Lewis still here? Maybe not. Thank you again, everyone, for your participation tonight. We have recorded this, War for Life. We are grateful to you for providing the forum, and we will provide this information to you, same format, same way you got the notice about this event. We'll be sending an update about being able to view the webinar recording. Thank you, and